Conference. It is a strange time that we exist in just now. The motion before you is concerning the tooth tax. The tooth tax that just never ever worked with units of dental activity. The tooth tax made no sense to the profession. The tooth tax was never ever understood by the patients who paid it. And the tooth tax was only ever desired by the bean counters of the Inland Revenue, who insisted on patient charge revenue. Tooth tax became even more unbearable and untenable when the rates of tooth tax charge exceeded the payment made for the unit of dental activity for the dentist. And in effect, we as a profession were paying the government for the joy of performing checkups upon their behalf. Conference, now is the time to say no more collection of your tooth tax. We are in effect being paid by capitation, which is what we would prefer. If you want dental charges, get those dental charges yourself. We don't mind how you take it. You can collect it directly from the patient. You can get it through a voucher system. You can use grant and aid. But you get it yourselves, because we want nothing more to do with this invidious and poor system that is not understood by ourselves or the patients. Now is the time to put our foot down, Conference, and say, if you want your money, get it yourselves. Conference, I urge you to support this motion, and thank you.
Hey, well, there you go. That was Alistair McKendrick, and I believe that Ian Douglas would like to speak to this motion as well. So, Ian, let's hear from you.
Hi, can you hear me?
Yes, loud and clear.
Okay, sorry, I can't get my webcam on, so I don't know why, but NHS dental charges are not new. They were introduced within 3 years of the founding of the NHS in 1948 as a means by the UK government to apply a brake to the amount of treatment being provided by dentists on their patients. And those of us old enough to be working in 1990 will recall the government introduced a new contract that resulted in a £190 million overspend. The result the following year was a 7% drop in NHS dental gross fees to pay for their miscalculation in order to recoup that overspend. In Wales, we are fortunate enough to have a CDO who recognises that patient charge collection is an unfair burden on dental practices and is contemplating replacing patient charge collection by dentists with some form of centralised dental charge by Welsh Government. We have at the moment a momentum for change that, like it or not, is going to be accelerated by the effects of COVID-19. And this presents us with an opportunity to radically reform our NHS contracts, including shifting the tax collection burden of dental charges away from practitioners and back to government. If that can happen in Wales, then it's far more likely to happen in the other home countries. I would urge Conference to support this motion in order to prevent the errors of 1990 and 2006 being revisited upon our profession and to reduce the onus of tax collection on our already overburdened dental colleagues. Thank you.
Okay, well, there we have two speakers to this motion, and do we have any hands up? I believe there was some problems getting me being able to see some hands up there in the list, but I'll hang on, and if you want to put your hand up to speak to this motion, I'll just give it another sec. Yes, we have Lancashire and South again. So if Lancashire and South, would you like to speak?
I would like to speak to support the motion, a system where practices become blind to the status of a patient. So we don't know whether it's a patient in hardship or on benefits. We just treat patients as patients and everybody equal would definitely be an improvement for patients' welfare as well.
Okay, thank you for that. So it doesn't appear as though I have anybody else with their hand up. So we're going to go to the vote for motion 7 now, please. Okay, so do we want to transfer charge collection from practices to government? What does conference say to this? And we'll get the motion results in just a second. And that is an 82% vote for there. So that is quite decisively carried.
Paul Moore, and I'm Secretary of Derbyshire County Local Dental Committee. In 2019, nearly 22 million adults and 7 million children were seen by NHS dentists. This year, because of the lockdown, we have already lost over 10 million courses of treatment. The already difficult access problems are about to get much worse. The fallow periods we need for decontamination, for social distancing, the cost of PPE and our difficulty in accessing fit testing, our staff issues with childcare, shielding and their legitimate fears over their health and safety have all led to radically reduced patient volumes. Industry sources including BUPA estimate that the PPE costs per patient will increase by 700% for non-AGP activity and by around 6,000% for AGPs compared to the pre-pandemic costs. We already have an appalling state of recruitment and retention, morale and motivation across the dental profession. A decade of below inflation pay awards, worsening of terms and conditions, increased punitive scrutiny and probity, combined with the ever-increasing pension contributions and restrictive annual allowance, has meant that the NHS workforce is under profound strain. The DDRB recently stated in the last review that a long period of real-term pay decline over the last decade is starting to have a significant negative impact. Only 8% of private and NHS practices are confident that they can maintain their financial stability long term. For many practices, fewer patients and greatly increased costs mean many are facing financial meltdown and closure. Indeed, our LDC have already counselled one such principal who is finding the financial and emotional challenges to be too much for him to cope with. If the government pulls the plug, many contract holders may just walk away, the numbers simply not adding up for them. We are already experiencing a decline in the number of dentists who are willing to work full-time or at all in the National Health Service, particularly in England. Dentists across the UK are being forced to spend a greater proportion of their time on administrative tasks, reducing further the time they can spend on fee-paying clinical activity. This, together with the recruitment and other issues, has meant that 31% of NHS contracts were affected by clawback in 2019. We appreciate and thank the government for their financial help thus far during this pandemic. But previous cuts and clawback cannot continue. NHS practices need the financial guarantees from the government that they will fully fund their contracts into the future in order to provide the best clinical care for our patients. I ask for your support for this motion conference. Thank you.
Well, thank you, Paul. Now, currently, we don't have anybody with their hand up, and I know there's been a little bit of discussion as to whether people are actually being able to raise their hand. So you can see we've now got a slide with raise your hand here, there. There's still nobody who wants to raise their hand. I'd also make the point that you should have a complete list of all the motions so that if you do feel the need to speak, please raise your hand early. Don't wait to the last minute to do it. But no, I think that's a reasonable time for anybody who wished to speak. So perhaps we could move to the poll, please.
Please remember to press submit as well, folks.
Oh yes, press submit.
There you go, Stuart.
Right, well, that's clearly being carried. We've got 86% voting for, 6% against, so a very clear majority for that. Thank you.
In Wales, the proposal from Welsh Government of a recovery year for GDS dentistry with the removal of the UDA up until March 2021 is welcomed. The proposal of a system based on patient risk and patient numbers is sound in principle, yet requires more detail. We believe that we must use this year for recovery and not for full piloting of any permanent changes that could be implemented from April 2021. There must be ongoing engagement, collaboration and discussion with the profession to allow testing and learning in normal times when colleagues are able to see the true impact of any potential changes on their patients and on their practices. And as such, this conference demands that any proposed permanent contract changes in Wales are fully scrutinised by the profession. Thank you.
Thank you for that, Tom. Again, I see no hands up. Does anybody wish to speak? Tom, you've put your hand up. Now, we would normally invite you to respond or something. If nobody else wishes to speak, though, let's have a little bit more from you.
This is more a point of order, really. And it's coming in the chat about English colleagues. Can you hear me?
Yeah, there's quite a lot of interference with that, Tom.
Sorry, is that better?
Yes.
So it's a point of order, really, and it's how people will vote, because there's only three options. There's yes, no, and abstain. I worry there's not a this vote doesn't apply to me option, because there's already a lot in the chat about English colleagues voting on Wales only issues. And will that potentially skew the results, because some colleagues in Wales may wish to abstain?
No, it shouldn't do, because you anticipate what I'm about to say next, is that this only applies to colleagues in Wales to vote for. But it is a valid point, and I think it is important that everybody on the conference today takes very seriously the business of only voting to when they're entitled so to do. Now, I'll call again for anybody to speak, just in case you wanted to put your hand up. No, they don't. So please, may we vote on that? Remember, it is just Welsh members and Welsh Agenda Committee members who can vote. So clearly carried, 82% for, nobody against, and an 18% abstention rate. Thank you very much for that, Tom.
Hello, I'm Charlene Palmer-Anwar from Went LDC in South Wales. Welsh Contract Reform has successfully piloted the ACORN Risks and Needs Toolkit as a method to drive investment in NHS dentistry in Wales as an indicator to care pathways for treatment. It's being performed well once per year. ACORN, ACORN, is an assessment of clinical oral risks and needs using a red, amber, green scoring system. And the purpose of an ACORN is to understand what matters to patients and to effectively communicate the level of risk and need to patients or their carers, and work with patients in making them understand changes they can make to prevent dental diseases and maintain oral health. It leads to shared decision making in formulating a preventative dental care and treatment plan. An urgent ACORN is fundamentally identical to the full ACORN, but with minor exceptions. That the urgent ACORN does not request information on whether the patient's siblings or family members in their household have active decay, and it doesn't require a full BSP periodontal classification, although a BPE and periodontal health assessment still needs to be carried out on an urgent ACORN. The recent introduction of the abbreviated urgent ACORN is counterproductive. The recommendation for non-registered urgent treatment appointments to be 20 minutes currently exists. The urgent ACORN will increase this to a minimum of 30 minutes, therefore a 50% reduction in access or a 50% increase in funding for these sessions. And the recent introduction is illogical because A, the ACORN is not done well without a comprehensive examination. B, the vast majority of these patients will be read on the red, amber, green scoring system anyway. C, it entails asking lifestyle questions of a patient whose primary motivation is to just get out of pain. D, by making practitioners do urgent ACORNs during the current COVID-19 period, we're increasing risk by keeping the patients in the chair for longer than is entirely necessary. And E, patients attending for urgent dental care are encouraged to return for an appointment for a full assessment, where an ACORN will be carried out anyway. The conference calls for this unproductive use of resources to be immediately withdrawn from the contract development plans in all clinical settings in Wales. Thank you.
Well, thank you, Charlene. Once again, we have nobody wishing to speak to that. Give it a little bit of time. Anybody want to raise their hand? Okay, no. Well, in that case, we'll move to the vote. Again, can I just remind people that this is just for our colleagues from Wales, that particular reminder, if you're unsure as to whether you're entitled to vote, actually appears on the voting form. So it should be fairly straightforward. So just for our Welsh colleagues, please. And that's passed by a massive majority, 86 for, 14 against, without any abstentions at all, percentages, of course. Thank you for that.